There's a particular cancer showing up more in our fathers, our husbands, and our adult sons, a disturbing spike in the rates of head and neck cancers caused by a common virus found in a lot of us. Well, yesterday we met a man who was beating this cancer thanks to early detection from an unlikely source. In part 2 of our special health report, you may be surprised by who was often the first to spot these cancers in men. A few months before Steve Sicosio was diagnosed with HPV mouth cancer, he went to the dentist for a checkup and briefly mentioned a chronic sore throat. That appointment may have saved his life.
A year before that, I felt my tonsil had a very odd feeling, like something was kind of stuck on it. And I asked the hygienist to look at it, and they didn't really see anything because they can't get back there far enough.
And then you have your paropharyngeal fold behind here.
Dr. Joseph Pilatich is Steve's dentist. He looks for mouth cancers in all of his patients, especially men over 40. He says, like in Steve's case, lesions can be hard to spot in the lower throat, so he pushed him to go to a specialist. But Dr. Pilatich did recently find a cancer in another patient.
And I looked at the back of the throat. It was quite obvious to me he had a lesion on his left pharyngeal area, and I immediately dismissed my assistant because I was quite confident that I was dealing with HPV in situ or stage 1 possibly cancer. Papilloma is basically a viral wart, so when these things grow, they're not pretty, and it certainly didn't look pretty in the back of his mouth. You know, these cancers, they can hide. So as a dentist, you feel responsible. You know, you definitely, especially in males and, 30, 40, 50-year-old males, there's no way I would not do an oral exam without checking the oral pharynx area.
Oncologists say that dentists are more important now than ever in the war on HPV oral cancer. They are often the ones who spot it and urge men to get tested.
These cancers, if they're caught at an early stage, are curable, so there's no question about that. Obviously, there's some people that will have advanced disease that we're not able to cure, but HPV-related cancers are definitely curable.
And doctors say that since research has advanced, they can now determine if a cancer is caused by HPV, and that could be one of the reasons behind the spike. Well, tomorrow in part 3 of our special health report, we take a closer look at how we can protect our boys, what you can do to prevent this cancer, and not only your daughter, but also your son. That's tomorrow morning, same time, right here on Your Morning Albany.